Welcome to Park Avenue Synagogue's Keynote Speaking Series programs. I want to welcome everyone from wherever you are watching, and I want to thank Mara Bernstein and Lindsay Rubin and all those in our programming department for making this evening possible. These are summer conversations, last week with Tal Ben Shachar and Gretchen Rubin, this week with John Barry, next week with Cardinal Dolan and Reverend Bernard. Every Tuesday evening, an opportunity to connect to important conversations, great public intellectuals, as well as, of course, community, which is what our synagogue is all about. And it is great to be together. Nothing would give me greater pleasure, not just that we have the numbers that we do of people signing up, but email a friend, open up a bottle of wine afterwards, discuss the content of these lectures. When we are physically distant, we don't need to be socially distant, and let's keep creating community over the course of this summer. Before we dive in, I want to walk you through our program tonight. We're going to hear from John. I'll be in dialogue with John. If at any point you have a question, then you can click the Q&A button at the bottom of your screen, type it in, and click Submit. I'll see it on my end. We've also received some good questions in advance. So between the two of us, we'll have a lot to discuss. And without any further ado, I want to turn it over to one of our fabulous, I love all lay leaders, but without Susan Cantor, a whole lot in the synagogue would not get done. So one of the co-chairs of our communications committee who will introduce our guests this evening. Susan?
Thank you, Rabbi. John M. Barry is a prize-winning and New York Times best-selling author. The National Academies of Sciences named his 2004 book, The Great Influenza, the story of the deadliest pandemic in history, a study of the 1918 pandemic, the year's outstanding book on science or medicine. His earlier book, Rising Tide, The Great Mississippi Flood of 1927 and How It Changed America, was named one of the 50 best books in the preceding 50 years by the New York Public Library. His books have involved him in two areas of public policy: public health and flood protection. In 2004, he began working with several federal government entities on influenza preparedness and response. And he was a member of the original team that developed plans for mitigating a pandemic by using non-pharmaceutical interventions, i.e. public health measures to take before a vaccine becomes available. Both the Bush and Obama administrations have sought his advice on influenza preparedness and response, and he continues his activity in this area today. After Hurricane Katrina, Mr. Barry served on the Southeast Louisiana Flood Protection Authority East, overseeing levee districts in metropolitan New Orleans. Mr. Barry has worked with state, federal, United Nations, and World Health Organization officials on influenza, water-related disasters, and risk communication. Before becoming a writer, Mr. Barry coached football at the high school, small college, and major college levels. Currently a distinguished scholar at Tulane's Bywater Institute and a professor at the Tulane School of Public Health and Tropical Medicine, Mr. Barry lives in New Orleans. Please join me in welcoming John Barry to PAS. We look forward to a wonderful evening.
John, welcome on behalf of the entire community. Welcome. I'm just realizing we have a lot of parents and students in the Park Avenue community who are at Tulane, so perhaps they know you through that as well. It's great to have you, and I just want to kind of begin this evening where my last question I already know is going to be, which is on the question of leadership. And I know that tonight we're doing our program in memory of your beloved father-in-law, Daniel Edward Hudgens, a figure who played a key role at that moment of the 1954 Supreme Court Brown versus Board of Education decision when Eisenhower set through troops. It was actually your blessed father-in-law who made sure that the Greensboro community enacted and followed the law of the land. And so, so it's an honor to invoke his memory. and to think about the model of his personal and moral leadership at that time.
Thank you.
John, is it okay if I call you John?
Absolutely.
Okay. So John, let's just
much worse than that.
let's begin with the story of 1918. And maybe just by way of introduction, you could share with us the scope of what happened, where it began, introduce just how big was the pandemic then. Obviously, we'll turn to our attention to the here and now, but let's start there.
Okay. Well, that virus was much more virulent than this one. Thankfully, this one's quite bad enough. Worldwide, the 1918 pandemic killed between 50 and 100 million people. If you adjust for population, that would be equal to 220 million to 440 million people today. In the United States, again, a much smaller population, killed about 675,000. One of the oddities of the 1918 pandemic, influenza normally kills the elderly and the very young. In 1918, roughly 2/3 of the deaths were between age 18 and 45, and the peak age for death was probably 28. Quite unusual. Well, I'll let you go to your questions.
All right. Well, I have plenty of questions, and plenty are already coming in. And I just, I'm so excited just to be speaking with you that I have read your book cover to cover, and I have to tell you the thing that I admire intelligence. I admire people who can write clearly and beautifully. The amazing thing about the book is that sometimes you feel like you're reading a medical history, sometimes a history, sometimes public policy. It is an extraordinary, I mean, how nimble you are as an author, John, to be able to go from topic to topic to topic. I just can't recommend this book enough. What do we know about the transmission in 1918 from did it start in America and then go to Europe to the war front? Was it the other way around? Where did it start? How did it spread?
Well, when I was researching the book, I found the first reported instance of any kind of virulent disease, which was in rural Kansas, and I traced that to a military camp where it sort of blossomed. And so I hypothesized and even wrote a scientific medical journal article about that was a possible site of origin. And it got some traction, still has some traction. However, in the 16 years since the book originally came out, there's been a lot of work on the 1918 pandemic, a lot of epidemiological research, some of which I participated in myself. And I now think, while Kansas is still a possibility, I think it's more likely it started in China. But there are some very good virologists who are convinced it started in France. Vietnam's another possibility, and so even is New York City, where there was a very early outbreak that started certainly in February, possibly earlier than that.
All right. And now you touched on this a moment ago, but just maybe a bit of a deeper dive about who it hit, because one question that we're very aware of, we're aware of age, we're aware of class issues, we're aware of the soldiers and the barracks, the story you tell. What do we know about rural, urban? Who was hit hardest?
Well, it got everywhere, and rural areas actually tended to be harder hit, probably because they had seen fewer, in some cases, no influenza viruses before. So there was apparently some cross protection if people had been exposed to another influenza virus. In parts of the world that had possibly never seen no influenza at all, so-called virgin populations in terms of their immune system, they suffered. In some cases, 20 or 30% of the entire population would be killed, sometimes in an incredibly short period of time. 15 weeks, 20 weeks, something like that. In the developed world, in Western Europe and the United States, the case fatality rate was probably about 2 to 2.5%, but much higher in other parts of the world. But even within the developed world, that overall case mortality rate is kind of meaningless because certain subgroups, for one thing, people aged 18 to 45, but even within that group, there were significant differences. There's a whole series of studies of pregnant women, and the case fatality rate for them ranged from 23% to 71% in these various studies. So that's pretty horrific. Industrial workers, metropolitan life, found that over 3% of the entire population, we're not talking case fatality rate, we're talking out of the entire population. So the case fatality was probably over 10% of people in the age group 18 to 45, or actually their numbers for 18 to 50, died. In terms of race, oddly enough, the African-American community tended to have fewer people sick. It's not clear why, but if they did get sick, they had a higher case fatality rate. And on the one hand, rural areas tended to get hit harder if they hadn't seen any influenza viruses. But the cities, because of the dense population, might have higher morbidity, which of course we all lived through. You more than I in New Orleans, but New Orleans briefly had the highest growth rate for COVID-19 in the world. And you guys in New York certainly suffered your own problems.
Yeah. Now we've all sort of become more conversant in the language of the virology of all this, of incubation periods, how long things last, what contagion is or isn't, once you develop antibodies, and how it was striking to me. You actually entitle some of your chapters "Tinderbox" and the explosion, and what do we know about how the influenza was transmitted, and then maybe even how it's different than how we're looking at COVID right now, of what we do and what we're discovering?
The transmission is exactly the same, but in fact, there are remarkable parallels between the current virus and influenza, although there are significant differences. Droplets, airborne, fomites, which is things like doorknobs, absolutely the same. Some of the differences, number one, COVID seems to be more reliant upon super spreaders. I'm sure many people listening are familiar with some of the very recent studies that suggest as few as 10% of the people are responsible for 80 to 90% of the cases, or 80% of the cases, I should say, not 90%. That's one difference. You mentioned the incubation period. I think that's a hugely important difference. Influenza moves much faster than COVID-19. The incubation period is roughly a third as long. You're sick for a shorter period. You shed virus for a shorter period. Influenza would, in probably well over half, maybe as much as 2/3 of the entire death toll over a 2-year period in 1918 actually occurred in a 14 or 15 week period in the fall of 1918. So it's very compressed. And even within those 14 or 15 weeks, it would pass through a particular community in a shorter time, 6 to 10 weeks, and which is typical of seasonal influenza today also. Obviously, right now we're dealing with something that lasts a lot longer, stresses the community for a much longer period of time. Economically, is much more devastating because of that duration. and it would be even if we hadn't shut things down to the extent that we
And
did.
it lasts that much longer because, just finish that sentence, because it's
it's a slower moving virus. Starting with the incubation period, 2 to 14 days versus 1 to 4 days. Average incubation is 2 days or less for influenza, 5 to 6 days for COVID. Again, you're sick longer, you shed virus longer, so the whole experience lasts longer. The whole cycle, the generation of spreading, even if it were to become exponential again, as it was when this thing started, at least in New York, and for that matter in New Orleans, that takes a longer period of time. So it's almost like a slow motion. As fast as COVID seems to have spread worldwide, were it an influenza virus with the same susceptibility, it would have been much faster.
Got it. So, okay, thank you. Now, the first few chapters of your book, it's a medical history. You write about the establishment of the Johns Hopkins, about Rockefeller, these extraordinary personalities, William Welch, and the story of American medicine. It's almost a before and after book, with the pandemic in between. And what was the state of research prior to the pandemic? Where was it happening? There's a difference between whether it's the government, that now we have the CDC, then it was in the Army. Where were discoveries being made? What did we know? And frankly, what didn't we know at the time?
Well, obviously, we know a lot more today, but I may be the only person who thinks this, but if you ask me what I write about through multiple books, the theme for me is power. And in 1918, I thought the people who had some kind of power and focus on them would be the scientific community, also the politicians to a certain extent. So I did focus on the scientists. American medicine had been the most backward in the world through much of the 19th century, with the exception of surgery during the Civil War. American surgeons get a lot of skills. But at Columbia Medical School into the 1880s, there was nobody there who knew how to operate a microscope. At Harvard, you could fail you took 9 courses. They were all lecture courses. If you failed 4 of them, you could still get an MD. That changed when a recent graduate killed 4 successive patients because he didn't know the lethal dose for morphine, and they did some minor reforms. But even at Harvard also, there was nobody as late as 1880 who knew how to operate a microscope. And this is after Pasteur has already established the germ theory and made extraordinary advances. But Welch, whom you mentioned, and many other physicians were dedicated. They went to Europe, primarily to Germany themselves, to learn more and get really well-grounded in science. So as Welch said, the results were much better than the system. One thing I left out, practically every medical school in the country, the faculty was supported entirely by student fees. So if your check could clear the bank, you were going to be accepted as a student. When Johns Hopkins was founded in 1876, and the med school about 15 years later, that was modeled after German education. And Welch was the first dean at Hopkins, and he was recruited to create a scientific medical school, and with rigorous academic standards, requiring a bachelor's degree to get in, and so forth and so on. And he started out with a tremendous faculty. Everybody there was equal to the best in the United States, and many members were the best in their fields in the United States. he basically forced the rest of the country, Harvard, Columbia, Michigan, and so forth, in order to compete with them, they radically improved their education. Then in 1910, there was something called the Flexner Report came out, which scandalized the public. It was muckraking in a highly technical sense. People had not realized just how bad medical education was. Within a few years after that report, half the medical schools in the United States either closed or merged with someone else. In a remarkably short period of time, American medical science improved until it was equal to the best in the world. But I want to make the point that the scientists who were operating then were incredibly brilliant men. They're certainly as good as anybody we have today. There's one person, he's not a major player in the book, but give you a sense of how significant it was. They won't give you a Nobel Prize unless they know what you're hypothesizing is correct. It's not just a hypothesis. And there's one person in the book who won the Nobel Prize in 1966 for work he had actually done in 1911. He was that far ahead of the curve. And I could give more examples, but would probably be more interested in other aspects of the book or COVID-19.
No, I'm very interested. As a son and brother of a physician, they've asked me to ask all sorts of questions, but I'm not just going to favor them. But I have two more on the medical front, and maybe 10 more. But at the end of the influenza virus in 1918, correct me if I'm wrong, but there was no vaccine. There was no, I mean, it petered out. It's for all of this medical preeminence and Rockefeller and Johns Hopkins and Welch. I mean, Welch got sidelined. He himself was, so there's no, it died out, the virus, but not due to any medical breakthrough, which I can't help but think about our own moment right now.
Yeah, I think two things happen. Number one, influenza is one of the fastest mutating viruses in existence. Another major difference between it and COVID-19, or SARS-CoV-2, technically, if you talk about the virus. SARS-CoV-2 is much, much more stable, particularly the spike protein that's important in terms of developing a vaccine. It seems pretty stable, which is one of the reasons why people are optimistic about a vaccine. Influenza mutates so much more rapidly. So I think, and I can't actually prove it, but logic suggests that the virus mutated, became more mild. Simultaneously, people's immune systems have got used to it. The second, third, fourth time they saw the virus, they were better able to respond to it. So I think that combination caused the virus to become much less lethal. There are people, in fact, Klaus Storr used to run the influenza program for the World Health Organization a few years ago. Now with a pharmaceutical company in Europe, I know he's hypothesized that essentially the same thing will happen with COVID-19, that 2 or 3, 4 years from now, we won't need a vaccine, that it will become like the common cold because our immune systems will recognize it and be able to deal with it. That may be the case. I hope it's the case. And I won't say he's the only person who's hypothesized that, but I think that's a minority view at this point.
Thank you. So, of all of the responses, and here I find myself experiencing whiplash between whether I'm asking you about 1918 or whether I'm asking you about the present. I think the answer is both. It seems that there's a question of a vaccine. There's a question of therapeutic drugs to mitigate the effects of influenza or COVID. And then there are public health measures that we can take to flatten the curve, whether that's masks or physical distancing or having a dialogue like you and I are having by way of Zoom. So, what lessons were learned then? What public policies were enacted or not? And how does that impact us today, and how we should structure our response to COVID-19?
Well, I think there are two main lessons in terms of dealing with the pandemic, a pandemic of infectious disease, obviously. One, tell the truth. Could go into that in greater detail if you want. And second, things like social distancing or physical distancing, which is probably a preferable term, and hand washing, masks, ventilation, staying home when you're sick, things like that. All those things work. None of them are a magic bullet. The hope is if you layer one thing on top of another, then you can have a significant impact on transmission. Obviously you cannot close down the economy for month after month after month after month. We do have to come out of it eventually. New York is coming out now, finally. The rest of the country earlier. I think too many states came out too early. But there was one of the reasons I was asked to participate in the early planning for, or at least conceptualizing as to what to do in a pandemic was, of course, my knowledge of what happened in 1918. There were studies of cities and what they did, and there was a correlation between cities closing down early and outcomes, how many people got sick and died and so forth, how much stress there was on the local healthcare system. Back then, of course, they could only give supportive care. They did develop a lot of vaccines, but they didn't even know what a virus was. The vaccines that they developed were against secondary bacterial, or what turned out to be secondary bacterial invaders. In fact, if you get a pneumonia shot today, it is a straight line descendant of something developed during the pandemic by Oswald Avery at what is now Rockefeller University. If you were in 1918 fortunate enough to survive the virus itself and have a secondary bacterial invader, and you got a vaccine that happened to hit, it happened to be based on that bacteria, then it could be effective. But as a general rule, all they had was supportive care, and of course, they didn't have the kind of care we give today in an ICU bed.
Right. I mean, on these, I have to tell you, one of the most jarring scenes of the book, and I know why it was this war bonds parade in Philadelphia, and I couldn't help but think, of what happened Saturday night. And there was, we don't know each other, and I have no idea what your politics are or aren't, but I
have a brain, so we're probably similar.
But tell us sort of what happened in Philadelphia and the effect of that parade.
Philadelphia turned out to be one of the hardest hit cities in the country, and a lot of it was because of that parade. The virus was already in the city. The medical community, basically begged the public health commissioner and the mayor to cancel the parade. Philadelphia was then one of the most corrupt cities in the country. In fact, the mayor was indicted not for some minor corruption, but for as an accessory to murder. And this was in the middle of the pandemic, so he had other things on his mind. The public health commissioner didn't have the guts to stand up to the political machine. You let this parade go forward. There were several 100,000 people in the streets. And, again, an outdoor event is, with influenza as with COVID-19, is much safer than indoors. But if people are going to be packed together, if they're going to be shouting and singing patriotic songs, and of course people crowding to get closer to the street to get a better view, and just like clockwork, 48 hours later, 72 hours later, influenza pretty much exploded in Philadelphia. I think clearly connected to the parade.
Right. So reading incidents like that, I imagine you wrote this book long prior to, well, first of all, did you see this pandemic coming?
Well, anybody in the public health community, certainly anticipated, some pandemic sometime. Tom Frieden, formerly CDC director, and before that, New York City's public health commissioner, when he left the CDC, the Washington Post asked him what kept him up at night, what the nightmare scenario was. And he said, influenza, it's always a worst case scenario. In fact, because influenza is always out there, it's an animal reservoir virus, it always has this threat to jump species to humans. We've had numerous influenza pandemics, so that was the target. Obviously, COVID-19 is different from influenza. It's still a respiratory virus, and highly infectious, and obviously. But everybody thought that there would be some pandemic sometime. Hopefully, we'd be prepared. In terms of this particular pandemic, about the middle of January, and I didn't know anything more than what I was reading in newspapers. I was not privy to any secret information or anything like that. But it became pretty apparent to me that there would be a pandemic, that this virus wasn't going to be stopped. And I actually wrote an op-ed in the middle of January saying, it's exactly that. The working title was "This Virus Cannot Be Contained," although by the time it was published, I decided to soften it, pull back a little bit, and ask a question: can it be contained? I said probably not.
I just imagine you're like the guy watching a horror movie and saying, don't open the closet, don't open, something like that. And I'm wondering, so if knowing what you know about 1918 and seeing what you're seeing presently, if you could grab the present moment by the collar and say, please just, wear a mask, please just stay in your, what do you want to stand on a rooftop and shout?
Well, the whole thing's been incomprehensible to me. The most infuriating part of it is the non-pharmaceutical interventions. The public health measures have been proven incredibly successful, more successful than any of those of us who were sitting around planning them thought they would be. And had we done things right, number one, we would not have 120,000 deaths or close to it. And number two, we would not have had to shut down the economy. It's not either or. We could have done it the right way. There were people who knew how to do it the right way. And we not only didn't do it the right way, we are now in a position where things are just potentially getting worse, and potentially in some states getting out of control. And it's not just me. It's there are dozens, if not more than, well, in terms of people who would work directly into pandemic preparedness, certainly several hundred. But now, probably everyone in your synagogue can look at the same things and figure the same things out for himself or herself and feel the same frustration. It's not just Asian countries like South Korea. But, Germany, which has a federal system, so the president can't simply dictate to the states what to do. They had a bad start, as we did. But now they have fewer than 9,000 deaths in a population roughly a third the size of, I guess, less than a third, about a quarter of the size of the United States. Other European countries, the same thing. Even the ones that had higher per capita deaths, their curve went like New York City, and then it's now under control with the exception of the United Kingdom.
Because they did what?
Well, at least they had a plan. It was a bad plan, but at least they initially were thinking about trying to develop herd immunity. They did a lot of things wrong, as we have done, and which was ironic since, as you recall, Boris Johnson was very sick and hospitalized with the disease. They've made a lot of the mistakes that we made, and their tracing isn't going so well, and so forth and so on. In a lot of the southern states, and not just southern states, a lot of our states, we had no support from the national government on testing and tracing. The person in charge of testing in that task force for the White House was transferred from that job and not replaced. So there's essentially nobody in charge of testing at the federal level, where there should have been tremendous support coming from there. I mean, the basic idea when Trump said the federal government is the backup, of all the ridiculous things he's said in his 3 years, it's hard to say what's the most ridiculous. But in terms of actual policy, that may be the craziest. I mean, leadership is not being a backup. Leadership is getting up front.
Right.
And politically, this was so much in his self-interest to handle this right. Politically, Merkel's popularity, her ratings are the highest she's ever had. And Trump could have secured his reelection if he had handled this properly.
Right. It's interesting. In 1918, it seems that Wilson's attention was directed to the war front. And so talking about, I don't know if one would read that moment as an abdication of leadership, or he simply had different battles he was quite literally fighting, as compared to our moment, which, you're sharing your somewhat incredulous view of things.
Well, you're right. The federal government in 1918 essentially acted in quite similarly. They basically lied to the public, but the motivation was entirely different. They didn't want to detract from the war effort. They wanted to keep morale up. Turned out to be counterproductive. Even in the short term, sometimes lying works, at least for the short term, sometimes for the medium term as well. But, you could quote Lincoln and so forth. You can't fool all the people all the time. But, Wilson was so focused on the war, and he created an entire infrastructure designed to focus the entire country on the war. He created something called the Committee for Public Information. The architect of that committee said truth and falsehood are arbitrary terms. There's nothing in experience to tell us that one is superior to the other. All that matters is the inspirational value of an idea. So, and they had 100,000, what they called 4-minute men, who before every public gathering, every school board meeting, every vaudeville show, would stand up and give a very brief talk, and designed to keep morale up for the war effort. So that was sort of a carrot to inspire people. They also passed a law that made it punishable by 20 years in jail to, quote, utter, write, print, or publish any disloyal, scurrilous, profane, or abusive language by the former government of the United States. And they actually sent a congressman to prison for more than 10 years under that law. That was vigorously prosecuted It was actually upheld by the Supreme Court. Oliver Wendell Holmes wrote the decision, although he's normally considered a champion of free speech. Two phrases came out of his decision. One was, don't shout fire in a crowded theater, or you can't shout fire. The other is clear and present danger, which he used that reasoning to justify his decision. But again, the 1918 virus was so much more lethal and so much more virulent. You didn't have anyone talking about a hoax once it hit their city. You could die in less than 24 hours, actually in less than 12 hours. There are reports of people dying in less than 12 hours that are, verifiable. Uncommon, but it happened. You had horrific symptoms. People could bleed not only from their nose, and in some army camps where the data is good, 15% of the troops, of the sick soldiers had nosebleed, but you could bleed from your eyes and ears. Pretty terrifying symptom. So with things like this happening and with huge numbers of people dying, nobody in any city in the country was calling it a hoax. And yet national public health leaders were saying this is ordinary influenza by another name. It was referred to as Spanish influenza. So that disconnect between reality and what people were being told, and local newspapers were generally, there was fake news in 1918, but it was fake because the newspapers were printing what the government wanted them to say. There was a self-censorship. But that disconnect, all that did was lead to distrust and in some cases panic, certainly more fear. And I think society ultimately is based on trust, and without trust, society begins to fray and in some cases even disintegrate. So you have reports both in cities and in rural areas of people starving to death because everyone was so frightened they couldn't even deliver food to a family where everybody was sick and couldn't care for themselves.
Right. And what's striking to me and to many, the politicization of the public health crisis right now, where
that's incredible to me.
Where people are talking about, the use of a mask being an encroachment on someone's, personal liberty, or things like. I mean, that is. I don't know what to say to what my question is, but simply this toxic mixture of the two.
I mean, I agree with you. Again, it's incomprehensible that the response coming out of the White House, it's utter, incompetence it would give incompetence a bad name.
Right.
And we laugh about it. Unfortunately, the reality is it leads to people dying who otherwise would not die, and it leads to economic damage.
Yeah, tell us.
The economy could be functioning at a much higher level, and we could have tens of thousands of people alive who died, and they had done it right.
Right. And someone did ask a question about the economy then versus the economy now. Is it even possible to compare the effects of the influenza virus versus COVID in terms of the economy? Do we know what?
Well, there was a brief recession that was tied to the pandemic. But again, because of the speed with which influenza moves, as I said, 6 to 10 weeks in any given community. And of course, you're not out of commission for all that period of time. It was much less damage than has been done in the last few months.
Got it. Are we, right now, I don't know what's going on in New Orleans, but in New York City, I think literally tomorrow is a new, depending whether you're Long Island or in Manhattan, but the question of reintegration and phase one, phase two, and otherwise. And I'm a congregational rabbi, and my business is public assembly. So, what do we know about what happened it was the fall of 1918 when the influenza virus hit hardest, and what do we know was done then? What are your thoughts? It's a two-part question on questions surrounding public assembly here and now, or houses of worship.
In 1918, it varied city by city. In almost every city, not in New York. New York probably did less than any other city in the country. They didn't close schools. They didn't close any businesses. They didn't close bars, not restaurants. About all they did was recommend that businesses stagger their operating hours to lessen the crowding of public transit. And they did very little more than that, and that had a minuscule effect. That was because of politics. Tammany Hall had just retaken control of the city after several years of reform administration. But almost every other city in the country did close schools and did close things down. And that included bans on religious services almost everywhere. Again, that didn't happen in New York. New York City did have 33,000 deaths, which actually on a per capita basis was a pretty decent outcome. The reason I think that happened, one of your very first questions, you talked about where it started, and I mentioned New York City as a possibility. And there was a spring outbreak in New York that was certainly going in February. It's crystal clear that exposure to the virus in the first wave in 1918 was not a true first wave. It missed more places than it hit, possibly because the virus was still adapting to humans. It's not really clear exactly why. Los Angeles, for example, didn't have a single influenza death in the spring. New York had a pronounced spring outbreak. And it was crystal clear that first wave exposure gave very good protection against second wave illness. So I think the most likely explanation for New York not having a much worse outcome, even though it did next to nothing, is that spring outbreak. Again, almost every city in the country outside of New York, with just a very few other exceptions, did close down everything, and not everything. Bars, restaurants, places, public gathering, theaters. And of course, back then most people didn't even have a phone, much less internet or television or radio. So closing down theaters and places outside was much more of a stressful situation. And generally that lasted for a period of about 3 or 4 weeks, sometimes a little bit longer. Many cities reopened too soon, tried to close back down a second time, at which time they got tremendous pushback. San Francisco, somebody even sent a bomb to the public health commissioner when they tried to reimpose mandatory masking. So there was...
The questions we're asking right now about sports stadiums, about houses of worship, all these public, it sounds like we're way too early to even consider those things. Is that right? Or
yeah, I would think so. Yeah. In fact, in terms of the history, I think it was in the Times, a very good article about the Stanley Cup finals, which were canceled after they had actually started playing them in 1918, or actually that was in 1919. yeah, it's hard to say where we're going to be in the fall. I can't really see crowds in a stadium. I could conceivably see football, but it would be hard. I could imagine how it might work out. Depends how many compromises people want to make, what the players feel themselves. I think Tony Fauci said the other day it would be hard to see that many people in a bubble. That basketball, since it's so much fewer people, you could sort of see that happening. I know that again LSU happened to they've got 7 or 8. Their football team just started working out again in the last 10 days, and they've got 7 or 8 players just tested positive, so they're trying to figure out what to do there. Same with other major college teams. A lot of them have had players test positive, and I know the NFL's negotiating with the players, and baseball's negotiating with the players. It's too early to say, but I wouldn't be too optimistic.
Got it. So we're starting to, whatever the metaphor is, the shot clock is winding down. So I have a few questions I want to get to. One, just to make myself vulnerable here. I'm a pretty well-read guy. Your book was a #1, or was a bestseller. But I don't remember hearing about the 1918 influenza virus as sort of a subject on my AP US history exam or something like what is that just me?
No, I wouldn't say it was just you. And when I started the book, I actually didn't intend to write about the pandemic at all. I was planning to write a book about the home front in World War I, culminating in events in 1919, which were, one of the most dramatic years in American history. Obviously, I got diverted onto the pandemic, which originally was only going to be part of that book. Let me jump subjects to one other thing is school opening, since we were talking about sports. And of course, school's more important than sport. I'm probably in the minority at this point, but I think the data does support the idea of reopening the schools, both because kids aren't getting that sick. They seem, there are kids who do get sick, but it's very unusual. In influenza, it's standard to close schools because kids are super spreaders. That is clearly not the case with this disease. So, for those 2 reasons, I think that schools probably should reopen. Maybe I'm a little bit out front on that compared to other people, but I thought your congregation might be interested in that.
Yeah. And you think that goes the same, schools, and you throw in teachers in there. They're obviously a lot of armed.
Right. There are some teachers who may be elderly. I'm over 70, so that would be a problem for me. But I think that you may have to make some accommodations and maybe not require teachers to come back, but particularly if they have some vulnerability. But I don't think you would suspend the entire school year or part of it based on that. Again, based on the data, the kids are, they're not completely protected. There are kids who are getting sick, but particularly the younger that you are, the safer that situation is. They're not super spreaders, so it's not any more risky than any other part of the economy. When you close schools in influenza, repeating myself, that's because they're super spreaders. That's well established in influenza. Seems very clear it is not the case. And so you have the same problems that you are presented with any other part of the economy opening, but no special reason, in my view anyway, to keep the schools closed.
Got it. Thank you. We're wrapping up. Does your experience as a football coach, the fundamentals of blocking and tackling, what advice would Vince Lombardi have to give us right now?
It's funny. I don't know if, a friend of mine in the congregation, Julian Zelizer, I don't know if he gave that question to you or not, but the very first meeting in the George W. Bush administration that we had on pandemic preparedness, they invited the chief of infection control from the Hong Kong hospital that had the best result in the world on protecting healthcare workers from SARS. And roughly over 20% of the deaths in SARS were among healthcare workers. And it was hypothesized that a lot of them infected themselves taking off their personal protective equipment or some other careless act. And this gentleman from Hong Kong said the reason he had a definitively better record than any other hospital in the world was everybody knew what to do. He just made sure that people in his hospital did it. They did it all the time, and they did it every time. And as a former football coach, what I took away from that was, and I went around quoting to some friends, Vince Lombardi, blocking and tackling. You know what to do, but you have to do it. It's the same thing with wearing a mask or, social distancing, washing your hands. It's kind of tedious to do it for 20 seconds all the time. That's a long time. But you know what to do, and you do it. And again, I may have mentioned that to Julian. Maybe he prompted you to frame the question in that way.
You'll never know. You'll never know. But we can learn a lot from Vince Lombardi.
Well, I'm old enough to remember the Packers beating the Giants 37-0.
Okay. I want to thank you on behalf of the entire Park Avenue Synagogue to our special guest, to John Barry. Really just an extraordinary book, all too important. The Great Influenza, the story of the deadliest pandemic in history. We thank you for your time, your wisdom. I want to invite everybody, same time next week, conversation with Cardinal Dolan, as well as Reverend A.R. Bernard, the founding pastor of the Christian Cultural Center in Brooklyn, and we'll be speaking about our religious communities during these times, and it's going to be a fabulous evening. I hope that everyone is safe. I hope that everyone blocks and tackles, as John Barry advises us, and I wish everybody a good evening. Call someone up. Discuss this, set your own Zoom time, have your breakout room, and let's all form community. We may be physically distant, but let's not be socially distant as a synagogue community. Have a good evening, everyone. Thank you so much for joining us.